Retinal disorders: a complete guide to prevention, control, and vision protection. What are retinal disorders? Retinal disorders are a group of diseases that affect the retina, the thin layer of tissue at the back of the eye, responsible for receiving light and sending visual signals to the brain. The retina is essential for clear vision. Damage to the retina can cause distorted vision, blind spots, or permanent blindness, depending on the severity and cause. Common retinal disorders and what they do. 1. Diabetic retinopathy caused by uncontrolled diabetes. It damages small blood vessels in the retina, leading to vision loss. 2. Retinal detachment, a medical emergency, where the retina peels away from its supportive tissue, causing sudden vision loss. 3. Macular degeneration, age-related effects. The central part of the retina, macula, leading to central vision loss, usually in the elderly. 4. Retinitis pigmentosa, an inherited condition, causing night blindness and gradual loss of peripheral vision. 5. Retinal vein occlusion, a blockage in a vein in the retina, reducing blood flow and causing swelling or hemorrhage. 6. Central serous retinopathy, fluid buildup under the retina, usually linked to stress or steroid use, causing blurred or distorted vision. Causes of retinal disorders. Diabetes mellitus, main cause of diabetic retinopathy. Hypertension. Aging. Genetics or inherited conditions. Eye trauma or surgery. Excessive steroid use. Obesity. Smoking. Exposure to prolonged sunlight, UV damage. High cholesterol and blood clotting disorders. Effects on vision and life. Blurred or distorted vision. Floaters or flashes of light. Sudden loss of vision, partial or total. Dark or empty spots in vision. Difficulty seeing in low light. Loss of central or peripheral vision. Impaired reading or driving ability. Emotional stress due to declining vision. If untreated, some of these disorders can cause irreversible blindness. Risk factors. Poorly controlled diabetes or hypertension. Family history of retinal disease. Aging, especially over 50. Smoking and alcohol abuse. Obesity and sedentary lifestyle. Prolonged screen exposure. Stress and anxiety. History of eye injuries or surgeries. Prevention and control. Lifestyle-based prevention. Manage blood sugar and blood pressure. Control diabetes and hypertension with medications. Diet and exercise. Quit smoking. Smoking accelerates retinal degeneration and vision loss. Use protective eyewear. Prevent eye injuries during sports or hazardous work. Avoid excessive screen time. Practice the 20-20-20 rule to reduce eye strain. Get regular eye exams, especially if you are over 40 or have underlying conditions. Reduce stress levels. Stress is a known trigger for some retinal conditions, like central serous retinopathy. Diet, fruits and drinks for retinal health. Best foods for the retina. Leafy greens, spinach, kale, and collard greens are rich in lutein and zeaxanthin, which protect the retina. Carrots, high in beta-carotene and vitamin A, essential for retinal function. Fatty fish, salmon, mackerel, and sardines are rich in omega-3 fatty acids that support retinal cell membranes. Eggs are a good source of zinc and lutein. Nuts and seeds, almonds, flax seeds, chia seeds provide vitamin E and omega-3s. Whole grains, oats and quinoa for stable blood sugar. Crucial in diabetic retinopathy. Recommended fruits. Blueberries and blackberries rich in antioxidants that protect retinal blood vessels. Oranges and citrus fruits packed with vitamin C to support capillary health. Avocados contain lutein and healthy fats that aid retinal nourishment. Papaya antioxidants and vitamin A to help with eye cell repair. Grapes support retinal cell survival and blood circulation. Ideal drinks. Green tea contains antioxidants, catechins, that reduce inflammation. Fresh carrot or beetroot juice supports eye health through vitamin A and iron. Plenty of water keeps the eyes hydrated and flushes toxins. Low-sugar fruit smoothies, especially with berries, spinach, and citrus. Management of retinal disorders. Depending on the specific condition, treatments may include laser therapy to seal leaking blood vessels or reattach the retina, anti-VEGF injections for wet age-related macular degeneration and diabetic retinopathy, steroid injections or eye drops for inflammatory conditions, vitrectomy surgery, removal of the vitreous gel to access and treat the retina, photodynamic therapy for abnormal blood vessel growth, monitoring and managing chronic diseases, especially diabetes, hypertension, and high cholesterol. Early intervention is critical. Delays in treatment can lead to irreversible vision loss. Action plan, step by step. 1. Schedule an eye exam, especially if you are over 40 or diabetic. 2. Control chronic illnesses, diabetes, high BP, and cholesterol. 3. Adopt a retina-friendly diet rich in grains, fish, fruits, and antioxidants. 4. Exercise regularly, improves circulation to the eyes. 5. Use sunglasses to protect your retina from UV damage. 6. Stop smoking and reduce alcohol, both harm retinal circulation. 7. Follow up regularly, especially if you've been diagnosed with a retinal condition. 8. Stay hydrated, proper hydration supports eye metabolism. 9. Reduce screen time, practice good digital hygiene. 10. Take prescribed medications seriously, especially eye drops or injections. Summary. Retinal disorders are diverse, potentially sight-threatening conditions that often develop silently. From diabetic retinopathy to macular degeneration and retinal detachment, they all pose significant risks to vision if left unchecked. Many of them are preventable or controllable through early detection, lifestyle changes, proper medical care, and a nutrient-rich diet. Once the retina is damaged, restoration is difficult, so timely action is essential. Conclusion. Your retina is your gateway to the world. Once damaged, it rarely heals completely. Whether you're managing diabetes, getting older, or simply want to preserve your vision, caring for your retina is non-negotiable. Act early, eat right, control chronic diseases, and see your eye doctor regularly. Your sight depends on it.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.